we go. Welcome. Welcome to the webinar on Ayurveda for female health. We're going to talk about a very important topic today, fibroids, which unfortunately is so common and so prevalent in today's world. Before we start, I would like to acknowledge my teachers, in particular, Dr. Ajit, who taught me the advanced diploma in Ayurvedic medicine. And on the information that he taught me, this webinar is based on. Also, I would like to acknowledge my mentor and the beautiful, wise woman specializing in female health, Dr. Claudia Welsh, with whom I had privilege to study. And today you're going to get a lot of information that's based on her teachings as well. And finally, I would like to acknowledge the Russian Ayurvedic doctor, Dr. Boris Rogozin, with whom I had the privilege to study as well. So today's information that will be presented in this webinar will be a combination of my studying with these beautiful Ayurvedic teachers, as well as my own clinical practice and my own personal practice as well. So I'm hoping that you will find it useful and inspirational. A couple of words of warning. I will give you a lot of information today. And Ayurveda is very practical, but it can also be quite overwhelming in a way that if you haven't implemented a lot of these practices that we will be speaking about, it might feel quite overwhelming on where to start. So what I would recommend in that regard is listen to the webinar, but pick one or two things that you can implement this week and really implement them slowly and include them into your life, feel the benefits. And then in 1 or 2 weeks, try another 1 or 2 things. So implement things slowly, one by one. Don't let it all overwhelm you. Today is a theoretical webinar, so you'll get a lot of theory and practical information, but implement it into your life, make it your own. Just knowledge on its own is not enough. Knowledge without experience and practice is not enough. It becomes a ballast, and if nothing else, it will add to your stress in levels if you don't make it your own. Does it make sense? So, and finally, before we start, you will hear a few Ayurvedic terms. I tried to keep them Ayurvedic terms out of this conversation, but I will introduce a few Ayurvedic terms today. And if you're not familiar much, I'm just trying to grab main concepts, but it's not that important. What's important is what you carry for you in practical terms for your life, what you're going to change, what you're going to process, what you're going to digest, and ultimately make your own. So I think that's it. We'll start now. So what we will talk about today, right? So we will talk about fibroids from the Western medical point of view. It's important to note that I'm not a medical doctor. I'm an Ayurveda practitioner, so and we don't want to choose either or. We want to make the best of both worlds, right? So my view on the Western medicine is that it saves life, it does wonders. So we don't want to go just for the Western medicine approach or just for the Ayurveda. We want to blend both in our lives and take the best of both worlds. So we're going to talk about the Western medicine approach to Ayurveda, Western medicine approach to fibroids, and then we'll talk about so bear with me while we go through that theory, and then we will have a short break. And after the break, we will go to the practical session. And you will have an opportunity to ask me questions at the end, or you can, if you have an urgent, pressing question, you can type it in the chat. I will be able to see it and hopefully address it, right? So fibroids. What is fibroids? Fibroids is hormone dependent, benign in 99% of cases, formation or growth in the female reproductive system, inside or around the uterus. It is estimated, interestingly, that approximately 2/3 of women are affected nowadays, which is a huge amount, but only 20% are diagnosed only after women start having symptoms and usually go for the checkups with the GP and gynecologist. So fibroids are formed from the smooth muscle fibers and connective tissues around the uterus and can vary in size quite a lot. They can be tiny fibroids, say around 1 centimeter and a few grams, or they can be also huge growths as well. Obviously, the smaller the fibroids, the more recent the fibroids, the easier it is to return the body to balance, right? They can be singular or they can be multiple and come in clusters. And symptoms can vary quite a lot. Fibroids can be very small and asymptomatic. When the menstrual cycle, the reproductive functions are not affected, there is no woman doesn't experience any discomfort or doesn't even notice it in the majority of cases, or they can cause severe discomfort, severe growth, severe bleeding. So the range of symptoms can vary quite a lot. And the treatment of fibroids depends on the size, depends on the symptoms, and depends on the future. It depends if the woman's planning the future pregnancies or not. Right, so all these are factors. Symptoms of fibroids. The most frequent symptoms are menorrhagia, which is heavy or prolonged menstrual bleeding, clotting during menstruation, metrorrhagia, which is bleeding between the periods, which is usually always actually an indication of some sort of hormonal disorder, dysmenorrhea or painful periods. Sometimes when the fibroids grow and press against the bowels, there can be changes in the bowel motions and constipation and increased frequency of urination. In terms of complications for fibroids, a woman can experience pain, painful periods. One of the necrosis or fibroid degeneration can be one of the complications of fibroids as well. Twisting of the stem or rupture of the fibroid itself. Uterine bleeding, anemia is quite common in fibroids, particularly with heavy bleeding, lower back pain, fatigue, discomfort during sexual intercourse is common for a lot of women, and difficulties in conception, which can take place, or a woman can, or not, or a woman will have no problem in conceiving and carrying the pregnancy full term with fibroids. There's no one particular range of symptoms and complications, right? So now the Western medicine view on the causes does not give us a definitive answer. Among the causes in the Western alteration hormone disturbance are named, as well as vitamin D deficiency and excessive estrogen. Please note excessive estrogen. We're going to talk about it a little bit later when we come to the Ayurvedic point of view of fibroids. And as we mentioned before, fibroids can be located inside the womb and outside the womb as well. In 95% of the cases, fibroids is located inside the womb, inside the female womb. The most reliable fibroid diagnostic methods usually fibroids are diagnosed after a woman has symptoms, goes to see a GP and a gynecologist. Then an examination and palpation can be performed, and fibroids can be felt by the gynecologist, as well as pelvic ultrasound and hysteroscopy and pelvic MRI. There are a lot of beautiful Ayurvedic doctors that I know that can diagnose fibroids from the pulse. Unfortunately, this is not my skill set yet. I cannot diagnose fibroids specifically from the pulse, but a lot of beautiful Ayurvedic doctors like Dr. Ajit or Dr. Boris Rogozin can. As you might know, pulse diagnosis is one of the key diagnostic methods in Ayurveda, right? So here we go. Now, risk factors for fibroid formation. One of the important risk factors is surgical abortions. If a woman has gone through a surgical abortion, whether it's recent or even many, many years back, it's considered one of the risk factors. Interestingly, both in the Western medicine and in Ayurveda as well. In fact, Ayurveda teaches us that abortion affects both physical and subtle koshas or layers of the body. And after undergoing an abortion, there should be a proper post-abortion care, which is very similar to post-pregnancy care in Ayurveda, for the body to return slowly back to normal. For example, it is not advisable to go back to work straight away, and a lot of other protocols as well. Another risk factor is inflammatory conditions of female reproductive organs, which can be multiple. No pregnancy and childbirth in women 30 years of age and above. And one of the key reasons here is, again, we spoke about estrogen dominance. So it's considered that if a woman is washed by the estrogen more than those of a woman who's gone through pregnancy. Excessive weight and sedentary lifestyle, of course, but note that as well. When we talk about Ayurvedic approach, we will see that that is very important for fibroids. Hereditary factors, again, we will touch on that when we discuss Ayurveda. Immune and endocrine imbalances, because they nearly always stem from hormonal imbalances. And interestingly, prolonged excessive sun exposure as well. We can put a hypothesis here that it affects hormonal balance as well. Next, Western medical treatments range from non-surgical to surgical and even new innovative methods as well. Non-surgical treatments involve this or that form of hormonal therapy that either affects estrogen and progesterone, or it affects pineal and pituitary glands, which changes and alters how the luteinizing hormone, LH, and follicular stimulating hormone, FSH, are generated in the body. Does non-surgical hormonal therapy work? Yes. Again, with Western medicine treatment, consult your doctor and work with your doctor, of course, and assess the risk versus benefit always. Is there a benefit with hormonal treatment? Yes, it assists in shrinking fibroids and in some cases manages the excessive bleeding as well. But there can be side effects that you need to be aware of as well. Some side effects, for example, for altering FSH and luteinizing hormone can be premature menopause, can be with prolonged medication can be osteoporosis. And ultimately, hormonal therapy does not address the underlying cause. It alters the hormones and the fibroids shrink, but the underlying cause why the body produced the fibroids in the first place is not addressed, right? Surgical methods of treatment. Again, speak to a doctor. Ayurvedically speaking, it is indicated for larger size fibroids. Fibroid 10 or 20 centimeters large will be very hard to shrink on Ayurvedic protocols, although they will be useful anyway. But Ayurvedic protocols can be very effective for smaller fibroids. Again, with surgery, there in Ayurveda, in the ancient Ayurvedic texts, surgery was recommended, and in fact it was, surgery used to be a branch of Ayurveda in its own right. However, interestingly, Ayurveda says that the wound should not be operated on without extreme necessity, because any surgical intervention in the womb will cause leakage of energy, leakage of the female energy, which will take a while to recover. In terms of surgical interventions, they can, in the modern medicine, they can be minimally invasive. In some extreme cases, hysterectomy could be recommended by the doctors and indicated as well. And I have quite a few patients who've gone through the hysterectomy, which is a side consequence of fibroids, can be in very few cases. So no need to get alarmed, but it's good to be aware of. And there are new methods that the Western medicine is experimenting with. For example, uterine artery embolization, when the fibroids blood supply is cut off and the fibroids shrink, and treatment of fibroids with ultrasound waves or laser, electric current, and even extreme heat, or even freezing them. So these are the Western medicine treatment options, which please discuss with your doctor, right? So now we're moving to the Ayurvedic view of fibroids. In Ayurveda, the female womb is called Garbhashaya. And in that name reveals us a lot of secrets and a lot of main postulates of Ayurvedic view on female health. So Garbha means new life in Sanskrit, and Ashaya means vessel or container. So the Sanskrit word for the womb is a vessel or container for the new life. Garbhashaya, or the female womb, is the female power center. It is the seat of the energy that in Vedic tradition is called the Shakti, which is the female creative power that manifests all life. I wanted to say on earth, but it's actually all life in the universe, right? Everything that's manifested is manifesting through Shakti. So bearing that in mind, the female womb is the power center, the creative power center for not just of a woman, not just for humanity, not just for the earth, but it's a universal creative power center. The key purpose of the female womb is to create and protect the child until childbirth, and also energetically to create the environment for the upbringing of the child. So while the heart, or Hridaya, is the main emotional center in all humans. And in Ayurveda, it's called the place between the head and the mind. Interesting, huh? So the females, Ayurveda teaches us that the females have an additional emotional center. Garbhashaya, womb, the vessel for creating the new life. And that Garbhashaya, or the female womb, is a strong female emotional portal. It accesses the female's karmas, desires, and intentions. So karma is different to karma. Karma is translated as a desire, and in Vedic tradition, it is one of the 4 purposes of human life, alongside with dharma, or duty or responsibility, artha, or prosperity, creating wealth, kama, desires, and ultimately emotional liberation. It is interesting, I personally find it is very interesting that karma, or realization of desires, is one of the purposes of human life. And Ayurveda explains that the soul, or Atma, chooses to incarnate, to realize its innate desires and to experience them in human body. And this is particularly pertinent for females. The seed of these desires is Garbhashaya, or the womb. So if these desires remain unfulfilled, then Garbhashaya, or the womb, can accumulate emotions, particularly suppressed emotions and desires, including what we call negative emotions: grief, sadness, fear, anger, loneliness, resentment, frustration, jealousy, you name it. Emotions per se are neither good or bad. They just need to be experienced and processed. When we start judging any particular emotion as good, as bad, and suppressing it and not allowing to feel that emotion, and ultimately for the wave of that emotion to pass, that can Ayurveda teaches us that suppressed emotion can be stored in the female womb, right? Also, in our modern society, stress, overwork, self-neglect, unprocessed emotions, and unfulfilled desires are quite prevalent. And according to the Ayurvedic medicine, they accumulate in females in the womb, Garbhashaya. And they can accumulate through all stages of life. Fibroids can afflict women in all stages of life. And at some point, these accumulated emotions will clog the emotional container of the womb, Garbhashaya, the vessel for the new life, the vessel, the container. And it might lead to physical changes, including fibroids. Talking about the emotional aspect of the womb, we can also link it to 2 different phases of the monthly cycle, right? And these 2 phases of the monthly cycle are the follicular phase and the luteal phase. The follicular phase is the first 2 weeks of the cycle after the menstruation, and the luteal phase is the last 2 weeks of the cycle before the menstruation, before the next menstruation. And it's important to understand what happens in these 2 stages of the cycle. The follicular phase, in Chinese medicine, for example, it's called the yang, or the active phase. Ayurveda calls it worldly and active phase, is characterized by the strong estrogen dominance. That phase is or should be characterized by an increased desire or propensity to be active in the world, to be more energetic, to be more sexual. It's a sexual, stimulating, active phase. And creative energy generated earlier is actively used in this phase to realize the desires that we spoke about, to make them real in a woman's life. And then the hormones change. We have the ovulation, which is stimulated by the luteal hormone. The hormones change, and then the luteal phase is characterized by the progesterone dominance, right? And this is the phase that Ayurveda calls passive phase. In Chinese medicine, it is called the yin phase, right? And the purpose of this phase is for female to start feeling and processing and getting in touch with the deep emotions, and bring all the suppressed emotions to the surface, all unrealized desires to the surface, feel them, process them, get support to digest them properly, so that the creative energy flow will flow unimpeded once this phase is over, once the next follicular phase comes on. During this phase, a lot of women experience PMS. A lot of women are quite tender, but they don't know what to do with it, right? So usually it just, in our society, is seen as an uncomfortable phase. But during that phase, the emotional portal is open. There could be more feelings of vulnerability. A woman becomes more intuitive, and the intention behind it is to feel and process these emotions and imprints, right? Now, before we move to the next slide, I want to talk a little bit here about the estrogen dominance that we touched on earlier. So, Western medicine names estrogen dominance as one of the reasons for fibroid formation. As we can see from these little graphs, you don't need to look through the details, but there is female hormones are much more complex than male hormones, for example. Female hormones, in a short period of time, in 28 days, a lot of hormones go into the bloodstream, into the circulation, need to do the job, and then need to be taken out of circulation very quickly. And female livers play a big role in taking hormones out of circulation. As you can see from the graph, estrogen goes up and it quickly goes down, progesterone goes up, and then all these hormones need to be deactivated by the liver, so to say, right? So female livers are working very, very hard. Female livers, in fact, are working overtime, and that's why females can be much more sensitive to alcohol or other substances than males. One of the reasons. And back to estrogen dominance. When the female experiences a lot of stress, overwork, in functional medicine, it is called HPA axis flare-up, hypothalamus, pituitary, adrenal. So hypothalamus, pituitary gland in the brain, and adrenals are working overtime. In practical terms, it means in addition to the female hormones, there is a lot of cortisol, there is a lot of adrenaline, noradrenaline, and other stress hormones circulating in the bloodstream. And when the liver prioritizes taking out of the bloodstream cortisol, adrenaline, and all these stress hormones, right? The sex hormones, including estrogen, keep circulating in the bloodstream, and that can lead to estrogen dominance. Make sense? So estrogen dominance, from an Ayurvedic perspective, doesn't actually mean that the body is stupid and it's producing more estrogen. In a lot of cases, it means that there are more stress hormones circulating in the body, and they're not effectively taken out by the liver. There is a lot of them. So I hope it makes sense, and I hope that's useful. Right? Next. So we're still on the emotional aspect of the female cycle and the female womb, which is largely influenced by our cultural conditioning as well. I'm sure you would agree. While in traditional or indigenous cultures, and Ayurvedic tradition is one of them, or the so-called yang cultures, a young female received a lot of support from the mother and all grandmother and all female relatives, and even female societal circles. A young female received a lot of support in training her to process her emotions from a young age. And the elder females served as role models themselves in an ideal traditional society, right? And menarche, or onset of menstruation, was seen as an initiation into womanhood, often accompanied by rituals and ceremonies to mark the transition, which were educating the young female on how to deal with the new her, right? How to discover the femininity and what to do with the new world of emotions and feminine energies that's opening up. And the menstruation in traditional cultures is actually viewed as one of the biggest gifts and the biggest blessings, which is very interesting and very different to what I, for example, grew up with. And menstruation is seen as an opportunity to reset and a powerful physical and emotional detox. In westernized cultures, and of course I'm generalizing here, not every family is the same, and not every Western culture is the same. But however, that seems to be a generalized experience, and that certainly has been my experience growing up. Not yours, but most likely it would have been. So in Western and westernized cultures, often family clusters carry on quite a bit of generational trauma, and even traditional societies nowadays as well, like just look at the indigenous Aborigines. And often family cluster judges emotions as incorrect, socially unacceptable, inadept, and discourages going into sports, encourages emotional suppression and being good and being successful and this and that, and discourages seeking an emotional freedom. The female cycle is misunderstood, and very often it's seen as a curse for females. Culturally, you know how we spoke about the first part of the menstruation, the first 2 weeks being an active phase, and the second 2 weeks need to be an introspective phase, where the outward activity in the world is curbed down, where there is more time spent resting, relaxing, introspecting, digesting emotions. So in the Western cultures, this is not recognized. An active female is valued more over a passive female, even during the time of menstruation, which we see a lot during schooling. I look at the ads, need to be active, blue liquid, soldier on, social expectations, sports, promotion of tampons, achievement-oriented model, the society that values outwards activity, not inward introspection. We'll touch on the menstruation a bit later as well, but just a couple of words on menstruation. In Ayurveda, menstruation is the time when the female becomes less physical, meaning her subtle bodies open up quite a lot. She becomes vulnerable. And it's a moment of a significant physical, subtle, and emotional detox and letting go of regeneration. During menstruation in Ayurveda, outward activity is not recommended to the degree that it's possible. During menstruation, for example, sexual activity, physical activity is not recommended as such, right? So, yeah. Just moving on with the Western approach. Often mothers are not only not for the digesting, processing emotions, but quite often they also themselves carry a lot of generational trauma. And it's not that they don't want to be good mothers. Every woman does, I'm sure. But a lot of women don't know how, because that continuity somewhere down the line was cut off. And that can lead for a young growing female, and then later on in life, that can lead to feelings of emptiness. Emptiness is an important feeling for a female. And we'll see later why with regards to fibroids. So remember, the womb is Garbhashaya. Ashaya is a vessel. So the feeling of emptiness, an empty vessel, is a very significant feeling for a female. So feelings of emptiness and suppressing emotions can indicate incorrect understanding of her female nature, which can then lead to increase of the Vata dosha, and in its turn to physiological changes and hormonal imbalance. So now we've introduced an Ayurvedic notion of Vata dosha, and just a little bit of theory on what doshas are and what Vata dosha is, because that will be important in understanding the etiology information of fibroids. But I'm hoping that you found what we discussed till now, that you found it useful and interesting. I certainly do. We don't think about the emotional consequences of our behavior. Right. So now moving on to the Ayurvedic dosha principle. This is a little bit of theory, which I'm hoping you'll find interesting too. And those of you that know it already, my apologies for that. We won't spend a lot of time going through it today. So what is a dosha? Ayurveda as a medicinal science is an elemental science, similar but different to traditional Chinese medicine, for example. Ayurvedic view of the world, universe, humans, earth, is that everything in manifestation, either in gross or subtle forms, is comprised of elements: air, ether, fire, earth, and water, right? And in the human body, these elements organize themselves into doshas, or the governing principles. And there are 3 doshas: Vata, Pitta, Kapha. So why are we talking about them, and why? So Vata, as an organizing principle in a female, in the body, governs all movement. It governs excretion, circulation, menstruation, childbirth, urination, excretion of feces. So all movements and all channels of movements in the body. So when Vata in the body gets out of balance, there could be a process of constriction, shrinking. It can lead to constipation, tense nervous system, stagnation in the pelvis because of constriction, right? So it's important to note that. So the dosha of Pitta is based on the element of fire, and its main function in the body is the process of transformation, right? The process of transformation includes digestion of food, breaking down the food lines, then making the food your own flesh, right? So the seat of Pitta is in the liver, gallbladder, pancreas area, small intestines, and the blood. And hormones as chemicals fall under the organizing principle of Pitta as well. So Pitta is the principle of fire transformation. And the last dosha, not least, is the dosha of Kapha or Kapha, which is comprised of the earth and water element. Kapha is the anabolic principle in the body. It's a growth promoting, nourishing, lubricating principle. It has an unctuous quality. The easiest example of kapha in the body is the lubrication of mucus. It's a nodal fluid in joints. It's lubrication of the lungs, lubrication of the uterus and reproductive system. Without that lubrication, our body will dry and shrivel up. But in excess, the body accumulates mucus. It can promote growths, tumors, fibroids, and congestion, right? So Vata is the principle of movement, the freedom body. Pitta is the principle of transformation, and Kapha is the principle of growth and lubrication. Right? And here we come to fibroids samprapti. Samprapti is etiology or causative factors in Ayurveda. So in Ayurveda, fibroids is called Rakta, Gulma. Rakta is blood, Gulma is growth. It's a disorder of Ardhavahasrota, or the female menstrual channel. And in formation of fibroids, all three doshas that we spoke about previously are out of balance. But mainly, or the lubrication is vitiated or aggravated or increased in the body when extra mucus, extra stagnation is formed, and it's accumulated in the lower pelvis region. And the Vata dosha, which is the principle of movement, is also aggravated. Vata constricts that stagnation, and that stagnation sits in the lower pelvis area. Fibroids in Ayurveda is linked to a disturbed form of Vata called Apanavata, which is the downward movement of energy. The downward movement. Apanavata can be disturbed to a variety of factors. Interestingly, the downward movement can be of energy or vata, which, for example, is prevalent during the time of menstruation when things need to flow out of the body. Can be disturbed for example, by having sex during the menstruation because the flow goes the other way. Can be disturbed by inappropriate sports or physical exercise during the menstruation because the flow of energy goes a different way. And interestingly, although I don't know if it's practical nowadays, is the classical Ayurveda does not even recommend combing the hair during the time of menstruation. Because why? And first it seemed a bit archaic, but then as I thought about it, because combing the hair will draw the energy up, right? And will not allow the proper elimination of everything that needs to be eliminated. But that's probably not the most practical example nowadays. We do need to comb our hair every day, right? So, so Ayurvedically speaking, in fibroids, all three doshas are out of balance, mainly Vata and Kapha. Excessive mucus congestion leading to growth in the lower pelvis, and the Vata constriction, right? And the Pitta or the suboptimal liver function is involved as well. Interestingly, although I am not a Chinese medicine practitioner, in Chinese medicine, fibroids is often referred to as cold, damp stagnation in the lower pelvis area, coupled with lowered qi or energy in the liver. Now, the key reasons, physical samprapti or physical etiology, key causative factors for in Ayurveda for formation of fibroids is, of course, excessive, prolonged mental stress, overwork, doing a lot of work in little time under a lot of pressure. It affects female physiology, right? Affects female hormonal system. In light of everything we spoke about previously, lack of proper regular rest or relaxation, or even lack of the skills how to rest and relax properly. Suppression of natural urges, excretions, emotions, needs, improper menstrual hygiene that we touched on before, and excess activity during menstruation, abortions, and improper care after the abortion. And as we mentioned earlier, abortion, post-abortion care should be similar to post-pregnancy care. Long-term suppression of emotions, which also leads to physiological changes eventually. Relationship pressures, for example, a domineering partner, having no partner, feelings of loneliness. Lack of physical movement, which leads to accumulation of kapha or mucus stagnation in the pelvic organs. Kapha aggravating and Vata aggravating diet and eating habits, and we'll talk about diet later on. Disturbance of Agni or digestive capacity, for emotional reasons, incorrect eating habits, and production and overflow of ama or toxins. Ama is an Ayurvedic term, which ultimately settle in the womb and the lower pelvis area. And the energetic samprapti or the energetic causative factors in fibroids in Ayurveda are observed often in more mature women in perimenopause and menopausal age, and are unrelated to unconscious wishes and desires, karmas that we discussed before, unfulfilled. Particularly, again, Garbhashaya, the womb in Sanskrit, Ashaya is a vessel or container, right? Particularly if there is an unconscious drive to hold on to something, past, whether it's events from the past, or holding on to the youth, or holding on to emotions or ideas, or you name it, coupled with unfulfilled personal needs, karmas, and wants, that might create a desire to fill the void. Garbhashaya, Ashaya is a vessel, a desire to fill the void in the womb. And that desire in itself might, that unconscious tendency of the psyche might create a tendency for the fibroid formation. So another interesting fact that Ayurveda shares is that fibroids are often, not always, right? No one recipe fits all. Fibroids are often women who have problematic relationships with their mother, either lack of or limited maternal support or unskilled maternal support. And we don't want to judge our mothers, of course. They did the best they could. And it's not about that, and they had traumas and upbringing of their own, whatever. We want to take responsibility now for opening that channel of energy flow within us, right? So lack of maternal support on the maternal line, the feminine line, feminine ancestral line, disrupts the ancestral flow of subtle energy. And although Ayurveda is a non-religious medicinal science, it does recognize the forces, the subtle energies that that are very foreign to modern medicine, right? So disrupted ancestral flow of subtle energy can create, not always, but can create unconscious or conscious feelings of loneliness and emptiness. And it can contribute to fibroid formation. If these feelings of loneliness and emptiness are not digested and are not fulfilled by other conscious means of a grown-up woman, either through personal practices, breathing, pranayama, meditation, yoga, Ayurveda, dancing, walking, whatever else calls you. And importantly, support of female elders and support of a strong girlfriend network, feminine network around you. Often also, it is observed in Ayurveda that inner emptiness or the void in the vessel, the emotional void, can be linked to a strong wish around whether to have a child or not. For a lot of, not all, of course, no one recipe fits all, but a lot of women with fibroids either have a strong desire not to have a child, or on the other hand, have a very strong wish to have a child, but no opportunity to have a child. Maybe they're not in a relationship, or just doesn't work out. And it's related to an unfulfilled wish of close emotional intimacy. So all that leads us to realization how important it is to work with emotions, to feel the emotions and to process them properly. So I think that we will make a little pause here for a couple of minutes. So if you want to take bathroom break or make yourself a cup of tea, now is your time. If you are still with me, I would love you to share the key takeouts so far. We're going to move to the next section in a second, where we'll talk about the Ayurvedic practical recommendations on what to do with fibroids. But that flows on from everything we discussed so far. But if you can share a couple of things that call you in particular that you found interesting, that would be very interesting and great. And pause for a second. Hello again. I've got a couple of comments about the connection, and my apologies for that. I can't actually do much about it, but I will be emailing you the recording of the webinar. Hopefully it's recording and I won't need to do it again. And I will also email you the slides, so you will have the full copy of the slides. So let me have a look at the comments. Connection is not the best. Yes, I would encourage you to listen again to the recording anyway, because it's packed with information. This is not a practical session or a practical workshop. This is a lot of information that you will need to, I would encourage you to listen again and digest and make it your own, practice it in your life. Connection's not stable. Lee, I'm so sorry, could be mine as well. Old habits of suppressing emotion, maternal habit and attitude of family Western society said about this. Yes, that's true, I agree. And as I was pondering about that, I think it's important that we don't feel victims of that. It's important that we feel empowered to make change in our own life, even before overflowing, teaching our families or everybody else. It's important to digest it in your own being, and that would be the biggest contribution. Good, since I have unprocessed emotions and all this and so much more. And scope of work for all of us, always. It's important not to blame self or others. Yeah. Risk factors seem to be very relevant to me. Are there any cycles during menopause? Yes, menopause is a cycle in itself. I don't get your name. I only get Galaxy as there is a separate webinar that I did on menopause. If you would like a recording of that, please get in touch. To me, it's quite an interesting webinar, which I will be very happy to share with you. I love the part about the female cycle as a gift. Great, thank you, ladies. I'm really glad you're finding it useful. For me, it's certainly very interesting and useful information. So now we will move on to the Ayurvedic treatment of fibroids, right? And the Ayurvedic approach to treatment of fibroids. Mike Dooley helps with empowerment. I love his positive and especially positivity, and especially the way he delivers important, universal and life truths. Beautiful, beautiful. Thank you for sharing, Lee. Beautiful. Just one quick note before we move on the fibroid etiology and the emotional aspect that we discussed. Remember in the beginning, we spoke about the Western medicine calling fibroids a hereditary. One of the reasons for fibroids is hereditary, right? In Ayurveda, Ayurveda says that fibroids can be a common generational issue in a family unit. As a mother passes on the flow of energy to her daughter without any close connections or support. So mother learns certain behavioral and emotional habits, and then she unconsciously trains her daughter around the same behavioral, emotional patterns, right? So in that regard, both belief systems and emotional processing patterns can be passed on generationally as well. Okay, now moving on to Ayurvedic approach to treatment of fibroids. With regards to treatment of fibroids, we can heal, but as with anything, the results can vary. The results of treatments can vary quite a lot. For some women with smaller fibroids, for example, within 3 to 6 to 10 months of targeted effort, the fibroids the body can balance itself and the fibroids can disappear completely. For another woman, for example, a good result, a good outcome could be arresting the growth of fibroids. And that could be a good result in itself, or reducing the bleeding around fibroids. And for other women with very large fibroids, surgery could be indicated. If a fibroid is 20 centimeters, it's very unlikely that just through application of Ayurvedic regimes, it will disappear completely. So we need to be practical. We need to work with both Ayurvedic and natural ways as much as we can in a safe way. And we need to take the best of modern science as well, modern medicinal science, right? So what does Ayurveda have to offer us in terms of the treatment of fibroids? Number one, processing emotions on a daily and monthly basis is critically important, and as is learning to rest and relax, which most of us, westernized women, don't know how to do. Most of us, not all. We'll have a look at the dietary changes. We will have a look into simple kitchen spice remedies that you can use and why. We will speak about simple daily regimes that you can implement and that will assist with hormonal health and balancing the nervous system. Ayurvedic therapies that might be useful in fibroids, herbs and basics, and Ayurvedic detox. We'll touch base on the Ayurvedic detox as well. Okay, so processing the emotions, allocating time, setting time aside, planning it, scheduling it in your diary, as ironic as it sounds, is very important. Connecting and creating a warm, loving female community around you is very important. Connecting with your mother, if at all possible, right? Connecting with the elders, connecting with the girlfriends, connecting with your spiritual yoga girlfriend circles, and getting the flow of the female energy and the nourishment, the emotional support nourishment is very, very important. All right, no one answer fits all, no one recipe on how you do it, but having an intention, reaching out, important. Don't underestimate. So if the above is difficult, if connecting with the female elders is difficult or not possible, don't underestimate the modern ways that we can access support through counseling, psychotherapy, psychoanalysis, cognitive-based therapies, somatic therapies. One of the great emerging therapies for emotional processing that I highly recommend to everybody to try, just see if it's yours or not, EFT, or emotional freedom technique, or tapping. Easy, simple, but very effective. Ayurvedic bodywork, starting with simple Ayurvedic massage, is very useful in activating the parasympathetic nervous system and preventing the emotions going deep into the tissues, preventing somatic issues. Regular Ayurvedic bodywork is very useful. Acupuncture, energetic health, energetic healing, relaxation retreats, yoga retreats, See what calls you, and not everything at the same time. Doesn't have to be overwhelming. Has to be step by step, digestible, right? Plan 1 or 2 things that you will do or reach out. Yoga. On yoga, we will talk more on yoga later, but jumped at me. It's important on yoga, from an Ayurvedic perspective, to note that yoga that you engage for emotional processing specifically is not the acrobatic yoga, is not the fitness yoga, is not the same yoga as a body pump class in the gym. It has to be true yoga in the way that you hold the posture, you connect with yourself, you breathe through it, you breathe the right way, you feel the emotions, and you let the yoga posture takes its life, right? Another practice for processing the emotions is a daily review. Retrospective in the day. Daily review and emotional processing. That can take form of many different practices, and in fact most of the religious traditions and spiritual traditions in this shape or the other recommend a daily review at the end of the day, or an evening prayer at the end of the day, right? So whatever tradition calls you, practice it. Emotional processing at the end of the day could be as simple as you review your day retrospectively in the opposite sequence from the evening till the morning, and everything where your consciousness lingers on, you sit with it and process it, breathe through it, right? So that you don't carry that emotion with you later on. Because sometimes we rush through the day, something happens, you didn't have to pay attention to that emotion, and then something else, and it becomes a snowball, right? Another interesting practice that I not very long ago came across for processing the emotions, but that's not specifically for the day, that can go months or years back. So an interesting practice for processing the emotions is this. That practice is better done not when you're alone, because it can trigger things. That practice is done better if, for example, you are sitting in a cafe, right, and watching people and watching cars, and the eyes have a chance to observe things, right? And the practice consists of the following. Have a pen and paper in front of you, sitting in a cafe, watching people, watching the cars, and write any particular incident of strong emotional charge that comes to mind. And then start writing down all emotions that you're really feeling with regards to that incident while watching the people. Don't go too much inside, because it can trigger things. And then you will need additional support to unpack it. But if you start writing these emotions down, describing them on a piece of paper, feeling them, naming them, accepting them, this is a good practice for pulling these emotions out from your unconscious mind into the conscious for processing, right? If you have a chance to see a counselor or a psychotherapy, then to work with that list, great. Or if you feel the strength to digest it and sit with that emotions on your own, right. So that's a good practice. Pranayama practices. The simplest pranayama practice is diaphragmatic abdominal breathing. When you start the breath from the abdomen, you feel, then after that you feel in the middle part of your lungs, and then you feel the top part of the lungs, gentle pause, and then breathing out from the abdomen, middle part of the lungs, top part of the lungs. So diaphragmatic abdominal breathing is a great, it has so many benefits. You need to be disciplined to do it 2-3 times a day, 10-15 breaths, right, minimum. And it has so many benefits, from deactivating fight or flight response, from unfreezing the diaphragm, activating the vagus nerve, reducing the forces of vata, the constriction that we discussed earlier, contributes to the fibroid formation, right? And a lot of other negative things in the body. Diaphragmatic abdominal breathing is a simple way to increase your serotonin and dopamine, the happiness neurotransmitters, right? Regular practice will be very beneficial. Another pranayama practice that's wonderful for processing emotions, clearing the subtle channel, clearing and strengthening the nervous system, is alternate nostril breathing, or nadi shodhana, where you, so the way you do it is you pinch, there are 2 ways to hold the fingers. I'll show you first my preferred way. So you pinch, these 2 fingers go like this, and you pinch your nose with your thumb, your ring finger, and you breathe in on the left side. Gentle pause, breathing out on the right side. Gentle pause, breathing in on the right side. Gentle pause, breathing out on the left side. Gentle pause. Right, so I will do it one more time. You can do it with me, or you can watch. Another way to hold your fingers, if you prefer, you can put these 2 fingers, instead of holding them like this, you can put them on the forehead. But for me, this is less comfortable. So alternate nostril breathing is the powerhouse pranayama for the nervous system, for calming down the nervous system, for balancing hormonal and endocrine health, for regulating hormones, and a lot of other beautiful things. You will need to start, if you've never done it before, start with 2 minutes in the morning, 2 minutes in the evening, and then gradually build it to 10 minutes in the morning, 10 minutes in the evening. And 2-3 days to your time, gradually. Ayurveda favors a gradual approach. Ayurveda does not favor bulldozer approach, right? So if you've never done it before, doing it straight away for half an hour could be a bit too much pressure on the psyche. So 10 minutes in the morning, 10 minutes in the evening is good. If you feel called to do it for 20 minutes in the morning, 20 minutes in the evening, even better. So this is a wonderful tool to balance and process emotions, right? And it's cumulative. It has a cumulative impact on the nervous system. Next, a lot of us, including myself, have been conditioned that activity is the key to life, that we need to be doing something all the time in order to achieve something. And a lot of females now, at least in the societies that cultures that are familiar to me, a lot of females now need to learn to rest, need to learn to relax, need to learn to reset. A lot of my patients that I see in my Ayurvedic practice, a lot, a lot of women, when I ask them, how do you rest? I watch TV, I watch films, I do internet, I do Facebook and social media, I like shopping. So something along these lines, right? So all these mentioned activities is actually not rest for our nervous system. All these activities actually charge our nervous system up, right? They're not conducive to rest. Shopping, as wonderful as it is, and as exciting as it is, and I like shopping too. Shopping is decision making. Decision making is a mental activity and activity of the nervous system, not to mention Facebook, internet. You get the idea, right? So resting and resetting, allocating time to resting is important. Being in nature, connecting with nature, feeling the sun on your skin, really paying attention. What gets you places is focus, love, and attention. It's not just placing yourself in the nature setting and things will change, but it's paying attention to the nature. Focus, love, and attention. Where your attention is, the energy goes there. The energy goes where your attention is, or what's the saying, right? So being in nature, feeling the nature, feeling the sensations, feel the sun on your skin and focus on that. Touch the tree, feel the tree, focus on that. Look at the stars, focus on it. So much so that the mental activity starts being switched off, right? Look at the ocean, feel the water. The water, by the way, you know how we spoke about Ayurveda being an elemental science? Has particular affinity for balancing the hormonal system, right? So the ocean, looking at the ocean, working with water, looking at the water, loving the water, smelling the ocean, looking at the flower for a long time, and meditation in itself. People say, do you meditate? Meditation is love, focus, and attention, right? Looking at the flower could be a meditation. Walking on the grass mindfully could be a meditation. Lying on the grass. Listening to calm, relaxing music, nothing dramatic, for 20 to 30 minutes. It's actually a form of meditation. Yoga Nidra. There are a lot of YouTube videos on Yoga Nidra, which is just type in Yoga Nidra, which is in YouTube. It's a progressive bodily relaxation where you put your attention progressively during the different and relax different body parts. 20-30 minutes of Yoga Nidra a day or 2-3 times a week is a wonderful practice. Gentle, mindful yoga, often having a break before you get exhausted. Regular massages. As we spoke before, massages are very useful to regulating the somatic emotional responses, as well as physical benefits, of course. But as a small note, Ayurvedically, no massages or body treatments at all are recommended during menstruation. For the reasons we discussed previously, the energy flow doesn't flow the right way. Spending time with warm, loving women, people. Creative, joyful hobbies, right? Painting, handicraft, cooking, dancing, gardening. Yeah, you get the idea, and hopefully get some inspiration. Next. So next we're going to have about the dietary changes for fibroids. As we discussed, fibroids is aggravated vata and kapha in the body. Vata is constriction of the channels coupled with mucus and stagnation formation, right? So any cold drinks, fizzy water, and raw foods in Ayurveda are contributing to vata constriction, right? So any fizzy drink, sparkling water, fizzy water is out. Excessive raw eating, particularly in colder weather, is out if you want to effectively manage the fibroids, right? As well as kapha aggravating foods. Kapha aggravating foods, mucus forming foods. Cold milk products, not recommended. There is a great way to have a yogurt or a kefir in Ayurveda. By the way, short note that milk and animal proteins are incompatible in one meal Ayurvedically. And if you have, for example, fish or milk product, or chicken meat and milk products in one meal, that will not be digested properly. That will lead to toxin formation, which kapha aggravation eventually, right? But a beautiful way to have milk, a yogurt in Ayurveda is, or a kefir, is that if it's a yogurt, take plain yogurt, a few teaspoons, maybe 1 or 2 tablespoons, right? And put warm water over it and make it into a lassi drink by adding turmeric, a bit of salt, a bit of pepper, maybe a bit of coriander, whatever you fancy. And it will be a very beneficial probiotic drink with a vegetarian meal, will help the digestion of that meal. Or if you take kefir, then you can take a little bit more kefir, like 2/3, and add 1/3 of warm water so that it's warm, right? Then kapha aggravating foods, warm flour, too much sugar, heavy fats, eating before your previous meal is digested. So eating or snacking within 2 to 3 hours after a good meal also leads to improper digestion, right? And avoiding pitta aggravating foods that damage and stimulate the liver. Coffee, chili, alcohol, fermented food, peanuts, tomatoes, yellow cheeses, bread with yeast, and sour tastes as well. Here we go. So now, dietary change is beneficial for fibroids. The majority of your diet should be cooked vegetables. Include good quality whole grains. Include lentils. Interestingly, both Ayurveda and modern Western medicine do not recommend excessive meat consumption with fibroids, both, if any. So a good source of proteins in that case becomes lentils. But you need to know how to cook lentils so that they don't damage your gut. All lentils, smaller lentils, easier to cook than larger. So lentils need to be pre-soaked, and use hing, or a spice called hing or asafoetida, to help protein digestion of lentils. And all lentils need to be very, very well cooked, not crunchy at all, gut damaging, not from a tin or a can at all, gut damaging, right? So include sweet potatoes, carrots, raisins, fresh sweet seasonal fruit, sweet ripe seasonal fruit, not sour, berries, cruciferous vegetables, broccoli, cauliflower. Include spices and herbs with cooking that will help the digestion and that stagnation that we spoke about. Such spices as turmeric, coriander, fennel, fenugreek, ginger, cardamom, cinnamon go very well with sweet dishes. Experiment. Moderation is the key. We want to follow the middle path, not the path of extremes, right? So in using the spices, moderation is the key, but yeah. Next, kitchen remedies, simple kitchen remedies that you can use to help with fibroids. The first one is turmeric, saffron, and a little black pepper pinch, right? Very useful, not just for fibroids, but also hormonal support, emotional support, liver, anti-inflammatory. Mix it all together and add boiling water, and then allow to cool and drink. Probably easier from my experience if you don't put it in like a mug and then have to drink all that, but like a little shot, right? And you can have it as a shot. Caution with turmeric, don't have more than 1 teaspoon a day, particularly for people with gallbladder issues, as it can stimulate things and stimulate excretion of gallbladder stones, which can be uncomfortable. So turmeric, half a teaspoon is a safer quantity. Weak ginger tea. Weak is the key here. 1 or 2 slices of ginger, or half a teaspoon of grated ginger with boiling water, make it into a tea. Drink 1, 2, 3 times a day. You can add a little lemon juice to it. Again, wonderful for clearing stagnation in both the digestive system and everywhere else in the body. Clear the mucus, extra kapha, ama, toxins, anti-inflammatory, jam-packed with benefits, liquefies the blood. The gooey quality of blood becomes more flowy and liquidy, increases circulation, central and peripheral. Black cumin, also called in Ayurveda Krishna Jiraka, and Nigella, I think in the West, is Mediterranean seed spice. You can take a little bit of it to taste, 1/4 of a teaspoon. You can add it to meals, to cooked meals when you cook, or you can make tea out of it. 1/4 to half a teaspoon of black cumin with boiling water, and drink it as tea. Why buy packaged tea if you can avoid all the plastics? So black cumin, apart from being a wonderful digestive, great for gas, flatulence, indigestion, it also specifically has an affinity for the uterus, clears kapha accumulations in the uterus, improves liver, and has nervous system, calming the mind function as well. Aloe vera juice for excess bleeding clots, great for digestion as well, in moderate quantities. Everything is a middle path. Calendula, not strictly speaking an Ayurvedic herb, more than modern Western, right? But wonderful for clearing the uterus and the stagnation in the pelvis. Note, calendula is contraindicated in pregnancy. Any risk of pregnancy, you don't do that. And not the risk, any chance of pregnancy, right? Correction. So with calendula, you can buy it, or I'm sure you can hand pick it somewhere and dry it and use it. You can make it into a tea. You can make an alcohol with it, where you put calendula flowers in a jar, then put alcohol over it. More so, being Russian, you can try vodka or another strong alcohol, and keep it in a dark spot for 10 days. And then after that, you can take 1 teaspoon a day of that alcohol, not a whole lot, not even a shot, 1 teaspoon a day for 1 to 2 months is great for, has specific affinity for fibroids. Or you can use it as a water infusion. So calendula is a wonderful thing. Cinnamon. Cinnamon also, cinnamon is a common spice. It's a bark of a tree. Cinnamon verum is better than cinnamon cassia in my view. Cinnamon cassia has can have some of the undesired impacts on the liver with long-term use. I personally prefer using cinnamon verum rather than cinnamon cassia, 2 different types. Cinnamon verum is a little bit more expensive. So steeping cinnamon tea using cinnamon clears stagnation in the uterus, useful for uterine bleeding as well. Yeah, how we're going for time. You feel free to disconnect if you need to go. or if we go a little bit over time, we shouldn't be too much over time. Please feel free to stay. Next, Ayurvedic regimes. Ayurvedic regimes are great for combating fibroids. Are daily self-massage with Ayurvedic oils. We spoke about Vata aggravation, the constriction of the nervous system, constriction of the body channels, and Kapha aggravation, stagnation, congestion. So daily self-massage with warm Ayurvedic oils will be really useful here. The simple Ayurvedic oils that you can use are black sesame oil. For those individuals that are significantly overheated in summer, you can use black sesame oil, mix it with coconut oil. Coconut oil in itself is also great. It wouldn't be specifically very targeted for fibroids. You can also use Ayurvedic herbal oils. With Ayurvedic herbal oils, it's better that you get a professional advice. Because there are some Ayurvedic herbal oils that can heat the system, there's some that can cool the system. We need to know what's going on. The good generic oils are Narayana oil, for example, will be very good for not just the musculoskeletal, but also the nervous system, improving stagnation, anti-congestive. Good oil could be Danvantram oil. A good oil with severe kapha aggravation and overweight and edema, for example, would be Triphaladi oil or Purnanavadi oil, right? So with Ayurvedic oils, it's better that if you get professional advice, which oil is more suitable for your condition and for your constitution and imbalances. Next Ayurvedic regime is Nasya daily drops, preferably with an Ayurvedic oil called Anu Thailam. You can also use black sesame, it will be good, a little bit less effective. You can see it in the picture. So this daily regime will have a positive balancing, apart from clearing the sinuses and mucus in the head, right? It will have positive balancing effect on hypothalamus, pituitary glands, and we spoke about the HPA, hypothalamus, pituitary, adrenals axis, right? Will be very useful for balancing hormonal health. Nasya. Shira Pichu is a little home procedure which is wonderful for stress, mental, nervous tension. When you, so the way you do it is preferably with Brahmi oil. You can also use black sesame oil. You can moisten a cotton pad, just the cotton pads you take the makeup off with. Moisten with warm Brahmi oil, put it on your forehead, right? And lie and rest down for 20-30 minutes. You can do it during Yoga Nidra. So it will have a wonderful physical and subtle support. Head oleation to balance the force of Vata, to calm the mental disturbance, the emotional disturbance, and nervous system. Apply warm Brahmi oil on the scalp. It will also have a positive result for the hair, but hair is not the point here. The point is to apply the oil on the scalp, warm oil, massage it in, and leave it for some time or overnight to allow it to absorb into the brain. And another useful Ayurvedic regime for fibroids is castor oil packs. With castor oil packs, for my patients, I recommend it 50-50. So castor, and I'll explain why in a second. So to some I do, to some I don't for fibroids. So castor oil packs, fibroids is stagnation in the pelvis. And castor oil has a very penetrative opening up and decongestive property. So Applying warm castor oil on the lower abdomen, covering it with a flannel that's also soaked with castor oil, then applying the heat in the form of hot water bottle and keeping it from 45 minutes to an hour and a half on lower abdomen is a great way to break stagnation. The protocol for this is this. The protocol for this procedure is like this. For the first 30 days, you do it every day except for the period. For the next 30 days, you do it 2-3 times a week except for the period. And then you do it 1-2 times a week until you achieve the required result, right? One word of caution here, that if you start doing castor oil packs, expect your next 1, 2, 3 periods to be different and probably more uncomfortable. And it is explained that that's due to stagnation leaving the body with the period, right? It could increase the bleeding, more clotting, it could be more uncomfortable, and then everything goes to normal once the stagnation is cleared. The reason I said I don't prescribe it for everybody is if you already have profuse increased bleeding, if you already have anemia, then that could be a cathartic way to clear it. And that could provoke certain things, provoke anemia, weakness, fatigue, etc. So we want to be cautious here as well. And there are a lot of other beautiful things and herbs we can work with to clear stagnation. Hope this makes sense. Yeah. I think we're going to definitely run out of time. So maybe we have another 10, 15 minutes. We'll see how we go. If you need to go, please go. I will send you the recording. Now, yoga for fibroids. As we spoke, yoga and exercise. So yoga, gentle walking, swimming, even gentle jogging is gentle jogging is the key. Gentle is the key word. Is very good to increasing the blood flow, to opening the channels, to decongest, right? Yoga in itself is very useful for balancing hormones. As we discussed, not in a fitness or an acrobatic yoga type of way, but in a yogic way of breathing, emotion, getting in touch with your emotions, feeling, releasing, right? So general reduction of fat and excess kapha, regulating psychosomatic, psycho-emotional and moods, stabilizing musculoskeletal, cardiovascular systems, reducing physical, emotional, subtle tensions, increasing the blood flow in the lower pelvis, promoting muscle elasticity. Yoga benefits. Here we go. Now, caution. Consideration yoga and all other forms of exercise. Now, this is important. And yeah, so first, you need to ascertain if the fibroid is stable, asymptomatic, and not growing, or is it in the active growth phase? The active growth phase is usually could be indicated by uterine bleeding, pain, and of course ultrasound results over a period of time. It is recommended to get ultrasound results once you diagnose, if you're diagnosed with fibroids, ultrasound every 3 to 6 months to see whether it's growing or shrinking, what's happening there, right? Growing fibroid is likely to have a stem, right, like a little mushroom type of situation. You can see it in the picture, a little stem at the top, right? Or even inside the womb. And growing fibroids, for growing fibroids, yoga and exercise can have certain contraindications. If the fibroid's completely stable, asymptomatic, a lot of women don't even know they have it. So in that case, you don't know, you don't know, right? But if it's growing and you do know, the contraindications are excluding all postures, yoga postures, asanas, and exercise that can stimulate further growth, and twisting of the stem, and ultimately it's necrosis. And that involves all exercises with abdominal pressure that exert pressure on the lower abdomen, a lot of press-ups, and twisting poses, as they present a risk for twisting of the fibroid stem and subsequently necrosis. So here we go. Preferably, the mass market type of yoga classes, and if the fibroids is a real problem, the mass market gym yoga classes are not suitable here. Preferably, you need to develop a tailored practice with a suitably qualified yoga practitioner or yoga therapist who is proficient in female health. One-on-one yoga classes are recommended. So if you can explore that. Yoga postures to avoid. So yoga postures to include is Shavasana. Beginning the yoga posture with Shavasana is a good practice. Kneeling posture, triangle, camel, bow, bowed, butterfly postures. Postures that are increasing the flow of energy and the circulation in the lower pelvis are very good, right? Avoiding deep forward bends from the lumbar area. Asanas with abdominal twists, external pressure, hard pressure on the lower abdomen, holding the breath and breath control, and quick, jerky change of bodily position, for example, jumping push-ups. What's that modern type of exercise, like a circuit type of exercise, is not recommended. Yeah. Next. Ayurvedic therapies, professional therapies that are great for fibroids. Number one, always for almost any diseases is Ayurvedic massage, ideally, if possible, followed by the steam treatment, or at least a warm bath or a shower after. That will effectively deal with Vata and Kapha. Aggravations will be very useful for constriction of the nervous system and for stagnation, improving the situation with stagnation in the body, but also regular massage, regular Ayurvedic massage with warm Ayurvedic herbal oils will be useful in preventing the emotions to go deep into the bodily tissues and affecting them and creating a somatic condition. The next Ayurvedic therapy, which is useful for fibroids, is Shirodhara, which is becoming more and more popular nowadays, which involves pouring on the forehead of warm Ayurvedic herbal oils for a prolonged period of time to calm the brain, calm the nervous system, support hypothalamus, pituitary, pineal, increase production of neurotransmitters, regulate the production of neurotransmitters, serotonin, dopamine, promote relaxation, hormonal health, and even useful for emotional relaxation and processing of emotions. And it can even bring up suppressed emotions to the conscious part of us. So regularity here is the key. One therapy is great. General recommendation is at least once a month. Ideally, after a course of 3, 5, or 7 treatments, maintaining it once a month is a good outcome, but it all depends on your what you're capable of planning for yourself. And also a very interesting and not very well known Ayurvedic therapy called Hridaya Basti. You know, we spoke about Hridaya is being one emotional center for men and women having another emotional center in the womb, right? So very often in the condition of fibroids, the womb and the heart are disconnected, right? So Hridaya Basti, which is an application of warm Ayurvedic herbal therapeutic oils on the area of the heart, as you can see here in the picture, is which is a main physical and subtle junction in the body, right? Will help connect with emotions and strengthen the emotional center and connection with the womb. Particularly if Hridaya Basti is also accompanied by what's called Nimbuda or external Uttara Basti, which is a similar Basti on the womb area. So particularly if there's two, very good, useful for fibroids and generally for females as well. Yeah. Okay. So now Ayurvedic herbal medicines. A word of caution about herbal medicines. These are, so I've listed here some single herbs and some Ayurvedic traditional preparations that are used in classical Ayurveda for fibroids. Again, very important to note here that with herbal medicines is powerful stuff. It's important not to self-medicate, not to try things just because they're on the list. I've given it as an example, but I really put a word of caution here, not to self-medicate, but to see an Ayurvedic practitioner in your area or whoever you're connecting with, as usually Ayurvedic prescriptions work, Ayurvedic way of dealing with things would involve working with the gut, clearing the gut, stabilizing the nervous system, and then working with the fibroids and more fibroid specific medications, right? The doshas involved in one particular woman, or the energies that a practitioner can identify, could be a little bit different or very different to another woman, right? And the history could be different. So this is just for your general information, but important not to self-medicate as such, right? So I'll start with the very last point that I've written in here. Shatavari. Shatavari is a very well-known Ayurvedic herb for female health, right? It has received a lot of publicity, and a lot of females hear female health and start taking Shatavari. Shatavari is actually contraindicated in fibroids, so I would caution you not to take it as it became so popular and everybody's taking Shatavari nowadays. You can only take Shatavari if an Ayurvedic practitioner prescribes it to you, and only as a part of combined with other herbs, right? So don't take straight Shatavari as a single herb for yourself in fibroids. That's it, as it might encourage estrogen production and the growth of fibroids. Not a good thing. So another set of herbs that would be useful for fibroids and the vata constriction and aggravation is the herbs for balancing the nervous system, and for the herbs that will help with the emotional processing and emotional balance. There are some of them are well known, like ashwagandha, brahmi, gotukola. Some of them are less known, shankapushpi, jetamansi. They're all wonderful nervine tonics and nervine herbs, and emotional stabilizers as well, as are such Ayurvedic preparations as Saraswat Arishtam, Ashwagandha Arishtam. Arishtas are actually what Ayurveda calls medicated wines, contain small degrees of alcohol, which allows deeper absorption into the tissues. Kalyanak Kashayam would fall into this category as well. Herbs useful for fibroids and emotional balancing. Shilajit, great for female hormones, contains certain minerals as well, so wonderful for anemia. Shalaki is resin frankincense, also very useful for warming up the female reproductive system, fibroids, PCOS, endometriosis. Ashoka. Ashoka is probably the choice number one, always better combined with other herbs than on its own for clearing fibroids, for assisting with fibroids and excessive uterine bleeding. Lodra, very great FSH and LH balancing herb, indicated for hormones. Licorice, Kanchnar breaks out stagnations. Gugulu is a resin breaking things down. Amalaki, is a great herb increasing immunity. Haritaki, Pipali, breaking down stagnation in the body. Preparations that are indicated and useful for fibroids: Kanchnar Gugul, Sukumaram, Adi, Ashok Arishta, Lodrasava, and Chandra Pravabhati. I'm giving it to you for completeness with small print, not to self-medicate, unless you know exactly what you're doing and you've done a lot of research. Herbs useful for anemia. Turmeric, saffron, amalaki contains lots of vitamin C, lahasava, and chawanprash. Chawanprash is a delicious Ayurvedic jam for anemia. Could be prescribed to be taken for 3 to 6 months. Liver, gallbladder support, what Ayurveda calls pachakapitam. Herbs like kutki, bhumi amalaki, bringraj, kalmek, turmeric, varanadi preparation, and a lot of other preparations in Ayurveda. And lastly, so Ayurvedic detox is a good way to kickstart the body and the body's natural healing capacity, and the simple detox that you can do. And Ayurveda recommends at home. In fact, some Ayurvedic sources recommend it at the junction of every season, is a Mauna diet to give your digestive system a rest. Mauna diet of khichdi or vegetable soups for 5 to 7 days, even 3 days beneficial. Taking herbal preparation at the same time, if possible, or at least kitchen herbal remedies. And Ayurvedic body therapies, massage, shirodhara, or if that's not accessible, then at least doing self-massage and the home remedies that we discussed. And some of you might have heard of Pancha Karma, Pancha 5 Karma actions, 5 cleanses. Pancha Karma is the detox, best done in a clinical setting, cheapest done in a clinical setting in India, but you need to, not right now, of course, but hopefully soon we'll be able to travel. But you know, if you're going to India for Panchakarma, you need to know, do a lot of research on the place where you're going, as the efficacy of the clinics can be very different. And you can also do it at home under clinical supervision. I don't offer it to general public unless the clinical supervision of Panchakarma, unless you're an existing patient of mine who has been on the Ayurvedic diet and regimes for a long time, because it is important to establish healthy basis of healthy habits before undertaking of Panchakarma. Otherwise, it can be quite dangerous and ineffective long term as well. So what Panchakarma is 5 cleanses, taking out 5 actions, 5 cleanses, taking out the deep-seated toxicity, physical, emotional, mental, subtle, physical, of course. And these 5 cleanses involve, under clinical supervision in a certain sequence, there are a lot of protocols around it, involve, first one is Virechana, or therapeutic purging, which strictly speaking clears the pitta and the small intestines. Involve Vamana, or therapeutic what's the word, vomiting, right? Which cleanses the stomach and the kapha dosha. Involve the Ayurvedic pasti procedures or enemas to clear the large intestine, herbal decoctions, always herbal decoctions. Ayurveda does not favor water enemas or water colonics. And also the fourth cleanse is nasya, and the fifth cleanse is rakta mokshana, liberation of blood or bloodletting, which nowadays is mainly practiced as leech therapy or I think it's practiced in Australia, but it's practiced in India, it's very popular in Russia and in some other countries. So here we go, Panchakarma. I think that's all I have to share with you for today. So now if you have any questions, feel free to either ask me the questions or type them in. And I can see how, if I can unmute. No, at all. Here we go. We have now very few. So thank you for staying till the end. Thank you very much for your patience. And I hope you
Thanks,
find
Julia.
If you have any questions, you can ask me now or type it in.
Julia, thank you. Can I ask about the mono diet of khichdi?
Yes.
Does the khichdi have all the nutrients that you need?
The khichdi, so you're not going to take it for a month, right? Although I haven't done it myself, but some of my Vedic teachers have been on the khichdi diet for 40 days, right? So khichdi is the ultimate of the detox, and it has all the amino acids that you need. It might not give you necessarily the right fiber content or the, but as a mono diet for a short period of time, it's a
Okay.
Did I answer your question?
Yes, thank you.
What was that?
Khichdi is an Ayurvedic meal which you bring together lentils and you bring together rice and cook them in a certain way. I might post, I haven't actually, but I might post a recipe on Facebook in the next week, right? So lentils and rice with spices, and it's a certain type of lentils called mung beans, or sometimes pink or red lentils are used for khichdi as well. So cooking them together in a certain way with spices, that in Ayurveda is considered one of the most cleansing meals. I personally would find it very hard to be on khichdi for 40 days, right? But 5 to 7 days is a wonderful cleanse, right? It also creates an interesting fact about khichdi is that lentils and grains brought together create a complete protein. So they create complete chain, complete set of amino acids, right? So if you only have grains, you get part of amino acids, but if you have them in one meal, that's a complete meat replacement as well. And being a heavier protein, you use spices like turmeric, hing, etc. to make it easier for digestion. Some people like, a lot of people like adding vegetables to khichdi, then it's, you know, so here we go.
The castor oil, the one that you said, what type of castor oil?
You can buy castor oil in a pharmacy. I prefer an organic castor oil brand that I use in my clinic. So castor is a plant. In Sanskrit and Ayurveda, it's called erand, and it's got a very penetrating and breaking quality. With castor oil packs, this advice on castor oil I have always come across it as a sweeping advice for everybody with fibroids. From my own practice, though, I don't prescribe it for everybody.
I understand.
Yeah, because I'm cautious about extra bleeding. If the person has excessive bleeding and anemia already, and they're going to bleed more for 3-4 months, that might not be, you know, so you need to use your best judgment here. Yeah.
And here I have the word Hridayabasti.
Hridaya, yeah.
Yeah. I'm not sure why I wrote it down. I want to get that treatment with you. I think that's why I wrote it down.
Me too.
Okay, we can have a chat about that. But Basti, so Basti in itself means an oil application on the heart. Hridaya is heart.
Sounds amazing.
Hajan in Sanskrit. So Hridaya Basti on itself, I have experienced in India both Hridaya Basti and what they call the Nimbuda Basti, the same kind of Basti around the womb area at the same time, right? So one or both. One or both.
And do you do both?
I do both. But I can't do it for myself. I do it for but I've experienced it myself in India. Yeah, I've received both. Last time I went to India was a year ago for 40 days. No, not 40 days. It was 4 weeks panchakarma.
Wow. Yeah.
4 weeks, and yeah, that was quite interesting. An interesting experience.
Yeah.
Yeah.
Wow.
I've booked for another for October 2021.
Wow.
But I don't know if I'm being optimistic here.
Oh, that's plenty of time. That's another year.
We'll see.
We'll see.
We'll see.
So any more questions?
That's all. Thank you, Julia. It was perfect. Thank you so much.
Thank you so much.
Thank you.
Thank you.
Okay.
Chat soon. All the best. Bye.
Thank you very much.
Bye-bye. Thank you.